health conditions. A Hispanic female in her 90s with underlying medical health conditions who passed away on April the 6th. A white female in her 90s with underlying health conditions who passed away on April the 5th. A black male in his 70s with underlying health conditions, he passed away on April the 9th. A white male in his 80s with underlying health conditions who passed away on March 28th, and a black male in his 50s with underlying health conditions who passed away on April the 6th. And so as the information is presented to us based on the documents that we have, the medical records, then we are updating this information. So again, 40 new cases, 5 deaths, which brings the Houston total count to 23. Today, the City of Houston drive-through testing site started testing anyone who, whether they were symptomatic or asymptomatic. We have doubled the daily testing count to 1,000, and the tests are free to the public. And people can call the department COVID call center at 832-393-4220 between 9 and 7 p.m. to receive a unique identification code and then proceed to the testing site. As of 1 p.m. Today, we had given out more than 800 unique ID codes for COVID-19 testing, and we plan to cut it off for the day when we reach the 1,000 mark, and quite frankly, we could be at that point right now. It does indicate, with the amount of interest, there are a lot of people in the Houston area that want to be tested, whether they're symptomatic or asymptomatic. So many people called in earlier today. It overwhelmed the system, and we end up adding additional operators. We started off today with 18 operators, and we quickly increased that number to 25, and we plan on adding 50 operators, have 50 operators available tomorrow for the anticipated demand. And if you did not get in today, please call tomorrow. But bear in mind, these tests will occur every day. So please be patient. There are many people in the city who want to be tested, and the plan is to accommodate each and every one of you as we work every day to increase the capacity of our testing. Dr. Purse?
Thank you, Mayor. And yes, the response from the public has been remarkable. We had anticipated an increased call volume, so we had already added 10 call takers prior to today. And in spite of that, the number of calls that came in was overwhelmed the system for a while. Tomorrow we will be adding at least another 15, drawing on our partners, and I want to thank the libraries and Parks and Rec and our colleagues at 311 for helping us ramp that up so quickly. So we will have more call takers available tomorrow and try to mitigate this. But at the end of the day, the issue is there are so many people who want to be tested, and even by going to 1,000 a day, we ask that the public be patient with us. We will continue, moving forward with this. And I also want to thank our colleagues with the Houston Police Department who have been very instrumental in managing the traffic, which was remarkable today, and they did a great job with that. So I wanted to just make those comments about the call centers. A couple of other things that we noticed that the Mayor mentioned about our additional cases today, and you mentioned that yesterday versus today the numbers are smaller, and we continue to have this inconsistency in the number of cases that are being reported to us. And I touched on this yesterday, and I want to touch on it again today, that to all of our medical providers and the labs, the law in Texas says that when a positive result for a COVID test is obtained, you are to report that to the local health department immediately. That is the term that is used, immediately. And so when we get these peaks and valleys, when we get these peaks and we get as many as over 600 reports in a day that going back 6 weeks, that is not helpful. And that's why the law says that you are to report that immediately. And we understand that it's going to be a day before we get it, and we have to process it. But nevertheless, it is important that we get that information promptly. So by virtue of the fact that today the number was comparatively small, I take no comfort in that. And we need to work with our partners so we can all do better with that. In addition, the other count that we pay attention to is the number of deaths. And as will be posted on our webpage today, not only the the, age, relative age, the gender, but also the date of death. And you'll notice that with today's, 4 of the 5 deaths occurred within the last 10 days. The law requires that physicians report the death. They have 10 days to report the death to the local health department. We have asked by phone calls and calling around the city and working with our partners in the health department, in the medical community, that we've asked them to be more prompt than that. We would like to know within 24 to 48 hours, again, so that we can make more informed decisions. And you'll notice that in one of these, the person who died back in March. So this is now at least the second time when we have had a greatly delayed report of death. And we found this one through our efforts of going through death certificates. And there are many death certificates. This is a big city. There's a lot of people, the death certificates that occur per day. That's natural. But we've gone through those. We've culled through those and found, now this is the second time we found a case of someone who died related to COVID disease, which had not been reported to us. And again, that is not helpful. So again, to our physicians and hospitals and other healthcare providers, please recognize the vital importance it is to our elected leaders to be able to make informed decisions based on the information that you will be providing us. And so that needs to be done timely. And we're working together on this. This is a difficult situation. We've never asked this of you before. We recognize that. But clearly you can understand the reason why we're asking this. And so please pay attention. Do what you can to get this information to us as quickly as possible so that we can make more informed, clear-minded, strategic decisions. Mayor?
Thank you, Dr. Purse. So the first information we're getting from hospitals and from the doctors, and then at the same time, we are also combing through all of those records ourselves. At whatever point in time, all of the information will be made readily available in that regard. So today, 23 deaths, and then we're adding 40 new cases to our account. Let me also, at this point, let me also acknowledge Mayor Pro Tem Dave Martin and City Councilman Edward Pollard, who's also here with us as well. Chief Pena.
Thank you, Mayor. Thank you, Mayor. Good afternoon. My report's going to be short today. Your Houston Fire Department remains fully operational at this point. Our call volume has remained flat as well. I'm happy to report that the number of personnel in quarantine at this time has dropped. We're at 87 today. We still have one firefighter, Captain Capistran, who's still in the hospital. He's making good progress, and we hope to see him released from the hospital this week. We've tested 87 firefighters through the course of this operation for COVID-19. We've received 58 of those tests back, still waiting on 29. Of those, 28 have tested positive through the course of this operation. 14 of those, 50%, have since recovered and are back to work, and 14 are currently recovering. In regards to our occupation task force, we had 133 incidents, complaints in the last 24 hours. Again, we issued no citations. Every one of the businesses, we achieved voluntary compliance, and we're moving forward in that respect. That's my report. Thank you.
Thank you, Chief Pena. Chief Acevedo.
Good afternoon, Mayor. Thank you. Thank you. Let me bring this up. Here's our report in terms of our personnel. First, I want to start off first and foremost by letting everyone know we absolutely appreciate the continued prayers for Raymond Cervantes and his wife, Liz. She is doing well. As you all know, she was positive for COVID, but she's handling it well. He continues in ICU. He's still on a ventilator, but his lung the functioning of his lung continues to show some improvement. So we remain hopeful, and we just continue to ask for prayers for him and his family, and we truly appreciate it. As of today, we have 101 members of the Houston Police Department in quarantine, 73 classified sworn off personnel, and 28 civilians. We have had 162 members of the Houston Police Department tested for the virus. 156 officers, 35 have come back positive, and 84 have come back negative, with 37 pending. And we've had 6 civilians that have been tested, Mayor. 1 has come back positive, 1 negative, and 4 pending. We're up to 10 individuals that have returned to work, up from 7 from our last report, up to 10. And as it relates to the department, we're at 100% capacity. We All of our divisions are fully staffed, and our call volumes now appear to be coming back to historical norms instead of being down, with violent crime in terms of murder, which is starting to trend upward, which is a little bit of a great concern to us, and the assaults and domestic violence is a great concern to us. And so again, we urge folks to, especially when it comes to violence in the home, if you see any children that you see outside their home, if you start seeing any changes in their behavior, please, if you see any bruising on them, please let us know so we can take a look and make sure that these children and these families are safe. And to the families, just remember our partners at the Houston Area Women's Center and other partners are fully functional and available to you and to us, and there are other shelters we can get you to. If you're in a dangerous situation, please call 911. Let us know. We will be there and we'll help you out. And that's my report, Mayor.
Thank you. Chief Bunick of Office of Emergency Management.
Great. Thank you, Mayor. Thank you for your leadership and for your transparency and sharing these numbers with us daily to keep the public updated. And also, thank you for opening up the testing centers to everybody. I know there's a lot of people out there that really wonder whether they have the COVID-19 or not, and this is just one way to give them some peace and comfort. Regarding our personal protective equipment, as you can see, everybody up here has the mask. As a matter of fact, all city employees that are out there working have masks, so we're still looking at donations. So anybody that can donate, you can email us to donations@houstonoem.org, donations@houstonoem.org, and we'll make arrangements to pick up the supplies or arrange delivery. The quickest way to get the PPE out to the first responders and other essential city employees is through donations. So we appreciate that. I know the mayor is going to be talking about a donation right after this. We appreciate that generous donation. Thank you, Mayor.
Thanks, Chief Bunick. And you know, we've always said that the major objective of social distancing, staying at home, working safely, was to stay within our hospital abilities, capability of handling every patient that comes in, to provide them with the medical care and the attention that they need. And as of today, our hospitals, at least in the 9-county areas, are still within their baseline capacity. So that's good news. We take it one day at a time. And again, I want to thank people for engaging in social distancing. Houstonians have demonstrated their generosity during the public health crisis by donating goods and services to help each other and to help public health workers, first responders, and essential employees. And today, as we pretty much have done almost every day, I want to welcome Artur Elvizian, I hope I didn't mess that name up, to City Hall. He is the owner of many Jack in the Box restaurants in Houston, and he and his employees and other Jack in the Box restaurant owners are donating 50,000 vinyl gloves to the city of Houston for our healthcare workers and first responders. And I want to thank him and his employees for their generosity. Come forward, come on.
Thank you. My name is Artur Elvizian. I'm a franchisee of Jack in the Box, and I want to thank Mayor Turner and the leadership for inviting us and extending this invitation to us today. I'm here on behalf of 9 other franchise owners. So between 9 of us, we have close to 240 restaurants. And we're here because as a fast food operation, we were deemed essential business during this time. Jack in the Box is committed to keeping our doors open to serve our communities through takeout, drive-thru, and delivery. Jack in the Box still continues to promote health and safety both inside and outside of our restaurants by deeply cleaning and disinfecting our surfaces every hour, sanitizing our cash registers more frequently, along with enacting mandatory hand washing and glove and mask wearing procedures. Gloves are very hard to come by nowadays. So we wanted to share some of our resources with our local communities and our neighbors and our city who need them the most. Jack in the Box franchisees in Houston and Beaumont, we teamed up together and came up with a plan to donate 50,000 gloves to the city of Houston. Today, we're here to showcase that we are all in this together as we navigate through this new climate. Nine franchisees across the Houston and Beaumont are each handling their own tough situations, and I am so proud to say they are handling this extremely well. Each franchisee has implemented their own process to support their restaurant employees, keeping in mind the health and safety of our team and their families. These policies and procedures are based on corporate recommendations implemented at corporate-owned restaurant. Jack in the Box has also implemented new marketing initiative made specifically to assist our customers and neighbors during these uncertain times. For example, we have bundled new deals where we have packaged our most popular items to feed larger groups of people. And we also have a new product called popcorn chicken that people love. So our restaurants are open, our drive-thrus are open. We are working with third-party deliveries, and some of them are working with us with free, no charges. And also, we are open for takeout. Also, Mayor, on a personal level, I want to thank you as a chair of HEART for your ongoing support for HEART. HEART program deals with adults with intellectual and development disabilities. We train and teach them, and we put them to work. So just want to thank you, sir. Thank you, the leadership. Thank you.
Let me thank you, Atur, and then let me just say, as they help out our first responders and healthcare providers, let's help out all of our restaurants and order, get a takeout, help them out as well, because many of them are on the front line helping to serve the rest of us. So thank you so very, very much. Having said that, we'll pause now and take any questions that anyone may have. Dr. First, you want to take that one?
So we've done it both ways. We've done it where we've started giving out numbers for the next day, and what has happened is people have shown up on the first day, even though they had a number for the next day. So that didn't work out so well. So we've just left it for the numbers for today, and we've sometimes had as much as a 30% no-show rate. So what we're doing now is we're giving more numbers than, slightly more numbers than we are anticipating testing that day and trying to get it right for that day. But once we max out that, we're going to max out at that, and we'll start the phones again the next day because giving numbers for tomorrow didn't work out well. People started showing up, and then we had a bigger traffic problem than we already have.
So now, like, if you have 1,000 slots, you're giving, like, maybe 1,200 numbers or something like that?
Yeah, we're working the math on that, and we don't want to go over because we're actually limited. So the federal government has, given us to 1,000, period. So we really can't go above that. So we're going to aim. It's a little bit of a guessing game because you don't know exactly how many no-shows you're going to get. So if we wind up with between 950 and 100 today, or 950 and 1,000 today, I'll be very happy. If we wind up with 1,025, we got a problem because they won't take those extra 25. And if you let them sit for a day, they degrade and then they become not testable. So going over is not a good thing to do. Being a little under is where I'm hoping we're going to be.
And another question about testing is we've gotten a lot of, I guess, press releases from the Imogene or whatever, this mobile testing folks who say they're working with the city to take testing to vulnerable populations in their homes.
Yeah.
Is that something that's going on? Are you guys paying, like their cash price is $135? Is that what the city, how is the city funding that?
So that's a group called I'm Aware, and what they're doing is they've granted us 250 tests, and where they will go to the home, and generally the following day. So we're identifying people who are in particular situations where there's no way they could get tested any other way, and they have a need. And we are referring them to I'm Aware, who then go through their screening process to make sure it meets their needs. And if they do, then they will go there the next day. But we have 250 of them in a population of 2.5 million people. So it's a tiny number. We're trying to be very strategic with it. We've not advertised it because we only got 250 of them. And so that's been a bit of a challenge to try to make sure that we use all those without setting up another stampede of people wanting them.
Oh, but they have been advertising it, so I was just wondering if they say they're partnering with the city. I mean, there's no plans of the city to buy a bunch
not at this
of
point.
testing services from
Not at
them
this
or
point,
anything?
no, not at this point, not that I'm aware of.
Not with them at this point. I will tell you that we are working with others to acquire more testing kits in large numbers in order to expand our testing beyond the 2 FEMA sites, as well as the working with this particular organization. Hopefully, if things go well, we can have some announcement on that within the next couple of days.
Is that similar to, Harris County stood up to temporary pop-up sites, and that's in addition to their FEMA, they're funding it locally. Is that sort of what you're looking at as well?
Yeah, but this would go beyond that. We're looking at partnering with the private sector to really ramp up and expand the amount of testing that we can do. So we're in conversations right now. We'll see whether or not that can develop over the next day or two.
And do you know if that's going to be funded with local budgets that are already stressed? You're expecting a FEMA reimbursement, or what are you envisioning?
In large part, it would be a contribution being made from the private sector, at no cost to the city for the test kits.
Mayor, there are some issues which need to be addressed. One of it is the fight about the release of prisoners. At this stage, there is still that issue of who actually has the right and the jurisdiction to do that, whether it's the county judge, whether the judges. That is already playing out in the community, may lead to trouble. And a follow-up to that is, with everything you are doing, from my perspective, Dr. Pest can bear me witness, you have done a beautiful job. But when we situate what Houston results and output at this moment, having within the context of Texas, is very, very frustrating. Because Houston is known as the second state in the nation with the least amount of testing than some of the information that we are getting. So what is it that the other counties, the other cities are doing wrong, which is causing all of these problems? That Texas doesn't come up positively with the positive results that we are getting from Houston.
Well, you asked several things, and let me try to unpack them one at a time. With respect to the inmates or those in jail, let me defer that to the county, to the judges, to the state, because that's within their purview and not within mine. With respect to the testing, of course, FEMA has now authorized us to do more. So as of Saturday, we were able to double our capacity, and we've expanded today to anyone who wishes to be tested, whether they're symptomatic or asymptomatic. We all recognize that we need more testing, and every day, all of the jurisdictions in Houston and Harris County, areas outside of Harris County, we are seeking to acquire the capability to expand our capacity. So we are doing that. What I would say to you, taking a test will give you some degree of measurement of the community spread. But just like Dr. Purser said before, just because you take a test today doesn't mean you're not going to get the virus tomorrow. What I do look at are certain other elements that gives me a sense of what's happening within our respective cities. I look at, for example, whether or not the hospitals are still able to handle every patient that comes into their hospital within their baseline capacity. And the answer, as of today, is yes. That was the case yesterday, last week, week before. It remains the case today. And that's good news. So they have not had to go to their surge capacity, and that's a good thing. I look at the number of ventilators that are available, and they're able to handle that within their baseline capacity. The number of ICU beds within their baseline capacity. Now, bear in mind, anything can happen tomorrow or next week, but as for today, that's a good thing. I look at the number of deaths that are reported across the country, and that number today is, about 23,000? About 23,000. And I look at the city of Houston, the number that we are reporting today, that number is 23, okay? And so we are contributing 23 to that overall count of 23,000. And I think most people will agree that, you know, even though one is one too many, still that number is relatively low. So there are a number of elements, factors that we can look at to see whether or not social distancing, staying home, working safely, putting on masks are working. And I can tell you from all indications, and based on talking to the medical professionals, those who are doing the modeling, that Houston is doing well. But you can't stop. April is a critical month for Houston, so we really have to stay the course in staying home, working safely if you're an essential employee, wearing your mask, engaging in social distancing, not crowding the parks, not being in large crowds, and we have to really focus on communities where there are high-risk populations and vulnerable populations as well.
You've been calling for an increase in testing capacity. How does that factor into your discussions with the county judge in terms of possibly loosening the stay-at-home restrictions that are in place as we move closer and closer to the end of this month?
Well, testing will give us all a better sense of what we're dealing with out in the community. And so it's kind of hard to kind of lift the, I guess you could say, the restrictions until you get a better sense of what you're dealing with in your communities. So the more testing we can do, the more data we can have, because you want to make your decision based on the facts, the advice that you're getting from the medical professionals, the advice I get from Dr. Purse, from the hospitals, from our universities. All of that's critically important. Whether or not the hospitals have the capacity, okay, whether or not they're still operating within their baseline capacity, or whether or not they're having to go to the surge, or whether or not we have to go even beyond that, that's critically important. The amount of supplies. Because even when things start to open up, you're not going to open up all at one time and move forward. It will be in stages, in phases, and so I would suspect that we will continue to be asking people to socially distance themselves for quite some time. I think there will still be a requirement for people to put on masks, face coverings when they're out in public, to avoid large gatherings. You know, I think those elements will be in place. But at whatever point we decide or a decision is made to open up, I think it will be done in phases, and those decisions will have to be made in collaboration with our state leaders, county leaders, even city leaders, you name it. But I don't think anyone can make that decision unilaterally, and so it will have to be some joint decision making.
When are those discussions supposed to take place?
Well, quite frankly, those discussions in one way or another have already been taking place.
But obviously, I mean, with the end of the month coming, I mean, there's got to be some point in time where you're like, you know what, we just can't feasibly do this at the end of April, so we're looking at possibly the middle of May. So when would that type of discussion be held? Where it's
Well,
sort of
let me just put it this way. We have yet to reach our peak, and so the focus where I want people to be right now is that in the city of Houston, we haven't reached our peak. We can be anywhere between a week, 2 weeks behind New York, for example. So it's very, very important for those of us in Houston to stay focused, to stay home, to engage in social distancing, and to do everything we can to slow the progression of this virus. So to start having the conversation about opening up when we're still needing people to stay home and work safely, I think might be a little premature. As a policymaker, certainly, you know, I'm sitting down with my team and with others, and we evaluating and assessing all of the different scenarios and planning all of the points in time in which things will have to open up. But for right now, my request is very simple to people in Houston, and that is, let's stay the course, because what we're doing is working, and what we're doing will be saving a lot of people's lives. We're still trying to focus on people with underlying medical conditions who live in vulnerable communities. And quite frankly, many of them are scared. And so my focus right now are on individuals who are dealing with diabetes, heart disease, lung disease, sickle cell, dialysis, seniors. Because when I look at my numbers, there are people who have died in their 50s, 60s, 70s, 80s, and 90s, and in some cases even below that. So the focus right now should be on saving people's lives. And if we do that, and if we continue to do what we have been doing, then I think we'll have a very robust public conversation on when would be the best time to start opening things up. I'm like many people in this city, anxious to kind of get back to some degree of normalcy, but I also recognize patience is a virtue. And in this case, patience can literally save, if not your own life, can save somebody else's.
Thank you.
Thanks.
Mayor, I have a few questions. First one from the Chronicle. Can you address the new deal you reached with airlines and other airport companies to defer payments until next year?
Can we go with the COVID-19 first and wrap that up, and then we can
Okay, that's fine.
Thank you.
Next one from KHOU. How many calls? You already addressed that. Now that the city's testing capacity has doubled, has your ability to process these tests also expanded? If so, by how much?
So these are with the federal contract with the Quest Labs and LabCorp. And so they have increased their capacity as well with the federal contract. So the turnarounds are getting better. The return on that information is getting better. And so, but that's really a federal operation. It's not our lab. It's the federal labs.
Okay, and the last one from KHOU. Since testing supplies are limited, do you have any advice on who should call to be tested and who shouldn't?
Well, right now, with respect to the two test sites that we have stood up, whether you're asymptomatic or symptomatic, you can come and be tested. Just go through the call center and then get an authorization code and you can come. So it doesn't matter whether you're showing any signs or any symptoms or not, you can be tested at the two standing sites for the city of Houston.
You want me to say it again?
Yes.
So from the Chronicle. So it's from the Chronicle. Can you address the new deal you've reached with the airlines and other airport companies to defer payments until next year? How much money does it apply to?
Yeah, I think we'll deal with that tomorrow. That's a city council issue. We'll deal with that issue tomorrow. Yes. Okay, thank you all so very, very much. Thank you all. Appreciate it.
All right, Mayor Turner, they're not willing to commit to a date when he might lift the stay-home order and reopen the city of Houston. Says he's now focused on just keeping people safe and seeing how the city handles the peak that is yet to come for COVID-19. We talked about 5 new deaths to report in the city today, bringing the total, this is in the city of Houston, 23 people now who have died, 40 new positive cases to report. And they spent a lot of time during this press conference talking about the first day of the doubling of testing capacity at these 2 city sites. Now, 1,000 per day total that the city can do. You call a phone number, you get a number, and then you can show up to be tested using that number. And again, 1,000 a day, and if you don't get in today, the mayor's saying just try again tomorrow if you can get through. It doesn't matter if you have symptoms or not. You are eligible to get a test for COVID-19 if you want one and can get through to that phone line for the city sites. The city talking about partnering up with a private donor at some point. Sounds like that'll be announced later once they get it firmed up, but there could be a private donor offering more test kits, allowing the city to expand its testing even further than that. We'll have to wait and see on that. We'll get you back to Ellen right now, and we'll have the 411 coming up for you here in just about 20 minutes or so. You can always stay connected by downloading the KHOU mobile app. You can go there or to our website to watch this city press conference in its entirety if you missed any of it. I'm Russ Lewis. We'll see you in about 20 minutes.
So let's talk about, so Costco, you love Costco, right?
I do. I love it.